day, everybody. This is Chidere. Unfortunately, due to unforeseen circumstances, I can't be there today. But Miss Needham was so kind to let me do a recording of my presentation, and I hope that you guys are able to, um, understand my presentation via video. Um, so my project that I started to work on was I started working on this at the beginning of my clinical experience. And what inspired this project was the fact that I think it was on my second day of clinicals, um, there was a there was a issue of staffing. Um, the nurses were assigned more patients than they were used to, and it was really an uphill battle trying to make everybody happy and and still take care of the patients. So I started to think I started to think what kind of effect does the staffing issues and the nurse patient ratio have on patient outcome. And so one of the responsibilities of my preceptor, who is a CNL, is to assess the results of the HCAPS. And I'm sure you're wondering what HCAPS is, but HCAPS stands for Hospital Consumer Assessment of Healthcare Providers and Systems. And this is a tool that the Agency of Healthcare Research and Quality use to assess patient outcomes. Um, it's a survey that the patients receive after hospitalization at home, and they fill it out and they mail it back. And it's supposed to grade the hospital on the nursing care that they receive. It's a perception of how they were treated while they were in the hospital. And so one of the responsibilities of my CNL is to review this scores for the unit and develop ways to improve the scores. And so during my clinical experience, excuse me, she she received she we went over the HCAP scores, and so I decided to compare the HCAP scores between the months of August 2013 and August and January 2014. I decided to compare the HCAP scores and see what the staffing was like then, and what the scores was, and compare and see. And my my aim was to develop a tool that we can use to reduce the nurse staff ratio depending on what I what I determined from my study. And so I noticed that in the months when the HCAP scores were a little higher, I observed that the nurse patient ratio of 1 to 5 was maintained at least 70% of the time. And the months where the unit had lower scores, the nurse patient ratio was slightly higher, um, more than 70% of the time. And so I decided to come up with a suggestion for the nurse leaders and the nurse managers of this unit to, I wanted to present to them and this study, and kind of see how we can maintain the nurse patient ratio at a certain amount, at a certain number, so as to keep the HCAP scores, higher. So one of the things that I let's see, so some of the so during my presentation, or during my presentation, I invited the nurse managers, the assistant nurse manager, the CNLs from the different units, and the charge nurses. And hopefully with my short term goal, actually, for this project, is to just bring give the nurse managers the awareness that there is a correlation and there is a relationship between the charge between the nurse patient ratio and the patient care outcomes. My long term goal, however, is to drive down the nurse patient ratio and keep it at the point, long term, to keep it at a point where, we are able, or they are able to maintain a good HCAP scores. And so you might wonder, how was it received? I will tell you that it really, the nurse managers were really appreciative of this. It shed more light on what, of course, we already knew, but it brought it home. It drove it home for the nurse manager, and hopefully, budget, with budget, playing around with the budget, it's something that I feel like she's going to at at least attempt to maintain the nurse patient ratio at somewhere between 1 to 4 or 1 to 5. So that's my project, and I just want to say thank you to Miss Needham for giving me the opportunity to do this via video. I want to thank my classmates, my group mates, for helping me to execute this presentation today. I really appreciate Melissa and Blessing and Hughes and Peter. Thank you so much. And yay, we did it. Have a good day. Bye.